Welcome back to our Unclenched podcast. Today we have a special guest, Dr. Konstantin Ronkin. He is just a fabulous neuromuscular dentist. I've known him for years, and he's so intelligent, has so many things to offer us. And we're going to talk about his book, How to Find the Right Doctor. We get that question a lot on our social media. And but before we bring him on, I got to see what's up with Priya. What's going on? What's happening?
Gosh, the kids, they're like growing like weeds. And that's amazing.
Yeah.
And we have so much space in this house that the four of us sleep in one room because
that's not good for good sleep habit to have those kiddos in the room.
Girl, I'm good. I sleep better with Rohan.
Yeah.
Than anyone else. So if my son is next to me, I'm out. Like, no one else matters. So we're fine. Aww. But I'm also like, it's only going to last for like 2 or 3 more years. And then Serena's already like kind of over me.
You're better than me. I couldn't do that.
Oh, I love it. I love cuddling.
I love cuddling, but I need my own space when I sleep. So do you have any patients to talk about or anything?
Yeah. So there's a patient who recently posted on my Google reviews. She came here from the UK. And I actually was not sure I could help her. I was just like, I don't think you should come here. Because she was like, I can come and I can come get the orthotics and then I can't see you for like ever again. And I was like, I don't think that's a good idea. Like, there has to be some sort of phase 2 or some definitive treatment plan to help you feel better, right? And she came for just phase 1, even against my recommendation, and she's doing so much better. She's like, I can chew, So that's been sticking out in my mind. But what about you? Do you have like someone that stands out to you?
Well, I had a patient in today, and his name is last name is Blanco, and the family has made a lot of glass products. And when I first met him, so this is not really dental, but I am helping him with his issues. But they have this glass company that's over 100 and some years old down southern West Virginia, and I happen to have like 3 of his water jars that you put in the fridge, and they were glass, and they made them years ago to fit on the door of the ice box. So he was in, and I said, would you sign him? So he brought his etcher and he signed his name, because now he's actually a cardiologist, not a cardiologist, an anesthesiologist for trauma. And he did that for 25 years, but now he's going back and retired and taking over the family company. And he was just on Good Morning America last week, or the Today Show, one of those. And so I'm like, okay, I need your autograph. So that was what's exciting for me.
As a neurologist, he was on Good Morning America?
No, he was on there because of his glass company. And he's an anesthesiologist. Pay attention, Priya. Pay attention.
Priya, it's too many things. How can one person do that many things?
I know. So listen, I want to bring on Konstantin. And I met him, and I've known him for many years. I think since like maybe 2009. And he maintains several practices. He has a practice in Boston. He has a practice in Moscow, St. Petersburg, Dubai.
What?
In Armenia. And he is the past president of ICMO, which we both belong to. And he was the past president of ICMO, both in America and in Russia. A great place to get more continuing education in the link with the body and the mouth. And he was a professor. I mean, just everything. He's just so accomplished that, I don't know, he's great. So Konstantin, so glad to have you today.
Oh, thank you very much. I'm glad to be here with you.
Oh, thanks.
I hope it's going to be a lot of fun today.
Yeah. So really what I want to talk to you today about is your book. So I read your book. I saw you in Chicago at a meeting, and you gave me your book, and he signed it for me. And I said, I'm going to read your book. And so it is called How to Find the Right Doctor and Preserve Your Health and Youth and a Beautiful Smile. So we have to talk about this. There's so much in here that I think people need to pick it up and read it. It's an easy read. The best thing about it, though, is there are QR codes all through it, too, that you can just put your phone. Let me find one.
Love that.
Like on the QR code, and then it explains more stuff. It's amazing. So let's talk. What's going on with you? Do you give this book out to your patients, or do they go buy it on Amazon, or how do they get a hold of it?
Yeah, they can buy on Amazon, or I mean, if I treat the patient and I need to explain a lot of things, the best way to explain, just, I mean, give a book and ask them to read. I don't know if they're going to read, but at
Yeah.
least we have a chance.
Yeah. Yeah. So what made you write this book specifically? What made you write How to Find the Right Doctor?
Basically, it's my patients. They always ask me a question, and the last drop was the question, if only I had known, and then whatever they asking me, if only I had known that I'm not supposed to extract these 12 years premolars or wisdom tears or something else. So, and then I decided, let me kind of put everything together and put in a book and educate our patients,
Yeah.
Well, the first quote in your book was, a good doctor treats the disease. A great doctor treats the patient that has the disease. Sir William Osler. This is so true. Can you elaborate on this quote that you chose? Like, why this one?
Then we need to talk about kind of neuromuscular concept and everything what we're doing. And we're not treating teeth. We're not treating like malocclusion or some TMD issues or sleep apnea issues. We're treating people, right?
Right.
With everything what they have. And this is a biggest difference between what all neuromuscular dentists doing and other dentists. Dentistry now, it's not only about teeth, gum, smile. It's not only about this. It's much bigger picture we need to see. And that's why we went through a lot of training to see all these problems, to see the interconnection of everything in our body. And since I'm a dentist, obviously I have to start with the mouth and teeth and the bite. But not only because I'm dentist, because a lot of things connected to the oral cavity, a lot of things connected to the bite. So, and answer your question, that's what make us great dentists.
Here. I agree.
I know.
So I don't know. It's a little bit kind of.
No,
yeah.
it's so true.
Yeah. Well, can you give our viewers and listeners a reason to read your book?
All right. I can give you many reasons, like 12 to be exact.
Yeah.
But you need only one. If you would like to be healthy, if you would like to have no TMD symptoms, if you would like to save your teeth for the rest of your life and have a beautiful smile, and understand how everything connected in your body. And if you would like to prolong your life, healthy life, that's the reason why you're supposed to read this book. You're going to understand how modern dentistry worked.
Right, right. So I talked about the QR codes a little bit that I loved that had the videos on it and about certain chapters and things like that. But your first chapter, I hear this all the time. If only I had known is your first chapter. And you talked about a patient from Paris and her veneers. And that speaks volume because I want you to tell that story because I found it fascinating. And as I'm reading, I can hear your little voice saying it. And I'm like, oh my God, he's in my head.
With my heavy accent, right? That's anyway. So it was a Helen. Helen actually lived in Paris, and she had a nice dentist. He did an excellent job. Gave her like nice smile with veneers, and when he visited Russia, one of the veneer came off, and she came to our office, and we fixed it. And I told her, let's investigate why you lost this veneer. But she didn't have a time. She refused to do any like further evaluation. And next, in 2 weeks, she came back with the same problem, different tools, but the same problem. And at that time, I told her, I'm not gonna put your veneer back unless we're gonna find out what's going on. And we did a CAT scan, and on a CAT scan, we saw very constricted, very narrow airway, like 3 millimeters on a sagittal view instead of like 10, 11, right?
Yeah.
Right.
And this is a very narrow airway. And what happened during the night, muscles try to open airway, and muscles pushed lower jaw forward, and her lower teeth kind of grinded through the upper veneers and break them all the time. And we found the cause, we found the reason why it's happened. And what we did, we kind of restored her lower teeth now in the right position of the lower jaw, in the right position from the point of airway,
Right.
because the body doesn't care about your teeth.
Yeah.
If you have a problem with the airway, body needs to breathe, right? Even if it's beautiful teeth with veneers, the body doesn't care. Body will open airway,
Yeah.
regardless what the cost, right? And this is what happened with her. We fixed her position of the lower jaw, gave her some restorations for the lower teeth, and now I didn't see her since. So that's the story. That's the story.
How old
Helen's
was she
story.
again?
Sorry?
How old? How old is she?
She was like mid-40s.
That's young to have airway issues, but that's again, the approach of looking at everything and the reason, not
Yeah,
just doing the Band-Aid.
totally.
Yeah. The problem is here that a lot of dentists just treating teeth. They
Right.
know how to make a beautiful smile, and that's it. But
That's it. Yeah.
these days, it's not enough. That's what I'm kind of try to put this across the whole book.
Yeah.
This
For many
statement.
people, it's not enough.
Right.
Yeah. Yeah. Right.
So then how do you explain neuromuscular dentistry to the patients or people? Is it like, because it's not taught in dental school.
Well,
So is
it's
it
not.
taught in Europe? Is it taught in dental schools in Europe? I know you teach over in is it Spain where you also are?
Not undergrad. It's not undergrad school, but
And it just has a bad rap now, which is so annoying.
not in Europe. But
I think it's turning around.
Oh,
yeah,
good.
I think so.
it had
Canada and US, it's a hot mess.
it had a bad reputation in the United States because it's a lot of kind of arguing here. But in Russia, for example, when we organized our neuromuscular ICMA organization, then we didn't have any kind of any problems. That's why we have even neuromuscular section in Russian Dental Association, and we're doing conference all the time, and it's
I love
very
it.
well accepted. Very well accepted.
That's
This
good.
concept. Yeah.
Where do you
So-
live, Dr. Runkin? Like, I know you have multiple practices, but like, what's your home base?
Boston.
Oh, it is Boston. Okay.
Boston. Yeah. So I kind of, it's funny story. So many years ago, I tried to go back to Russia to teach Russian dentist, modern dentistry. It was like 1999, 98, something like this. And then gradually, they asked me to see one patient, another patient, and then like year later, I started to see a lot of patients and open office there. And this is how all this started. And then whatever happened in the world, right? It's a lot of my patients left their country, and they asked me to open office somewhere else, and I opened in Dubai. So now I'm seeing patients in Dubai, and the same thing with Armenia. So it's not like I try to open office everywhere. I just follow my patients, I guess. That's
Well, they're very fortunate. But when you go to work in Dubai, did you have to get other licensure and stuff like that?
yes.
Yeah.
You have to pass the exam. You have to like
Go through
you
all
have to get a license.
Is it a board exam, like where you bring patients in?
Yeah.
Oh my
no,
God.
no,
Wow.
it's not practical. It's only like
Oh.
theory. You have to. I don't remember how many questions, but 500 questions or whatever. But it's serious exam. It's board exam. It's actually American board exam. So that's pretty serious exam, and you have to maintain it. You have to
Yeah. I mean, that's a
every
big
year.
deal.
Yeah. But I was lucky I passed this exam, which is, it's not easy when
You're
you're
really smart.
not young.
So I'm not surprised that you passed. So
I was surprised, but
Well, we're
it's all
not.
right.
come on. So let's talk about some subjects in your book. And you talk about a lot of nasal breathing and the importance. Priya and I have hit on that on different podcasts and everything. And can you explain why the reason you should breathe through our noses? We've said it so many times, but how would you say why we need to breathe through our noses, or the reasons we need to breathe through our noses?
Again, it's many reasons, but you need only one. And the one reason, the nose was designed to do this function. The mouth, it's kind of emergency exit. Obviously, we using mouth to breathe only when it's necessary, right? This is how it's supposed to be. This is how we design. Mouth is for different function. Mouth is like to eat, to talk, to do a lot of other stuff, but not for the breathing normally. But if you have a difficulties to breathe through your nose, the body kind of made it second way to breathe. And the reason why it's important to breathe through your nose, and like I said, nose designed to do this, because you have to clean the air what you breathe in. You have to the nose have a air conditioning function just to make it breathing air. It's wet enough and clean enough, and you have to smell, right? So we all forget about this function, but during the COVID, everybody just all of a sudden find out about this important function to smell. And it is another function, very important function, because in sinuses we produce the nitric oxide. This is very important ingredient gas, and when you breathe through your nose from the sinuses, this nitric oxide going absorb in your body. And it's very important component because it's regulate all oxygen function in the body. And if you don't have enough this nitric oxide in your body, you have all kind of problems, right? And it regulates cardiovascular system and other systems, like almost everything in our body needs this nitric oxide. But if you're mouth breather, you don't have enough nitric oxide in your body. And this is very important component that people who developed did a study and show us the function of this nitric oxide got a Nobel Prize for this, since this is very, very important gas.
As dentists, we have told patients that for good oral hygiene to use mouthwash. So I learned something in your book about Listerine. I think Dr. Alex and I both did. Can you tell everyone about that and what happens when you use Listerine?
Yes. Couple of things. First of all, you don't want to use a mouthwash with a lot of alcohol content, right? And because it can cause the dry mouth condition. This is number one. Number two, Listerine kills bacteria, right?
Right.
This is why we're using this.
Right.
Kills bacteria, but also it kills good bacteria, what kind of take nitrates and make a nitric oxide. But if you killing them with Listerine, you diminish the amount of nitric oxide.
Interesting.
Especially for the people after 40. Because after 40, the production of nitric oxide kind of naturally goes down. So that's why we need to be careful. We need to be careful and not kind of overuse mouthwash.
Wow.
So that's the reason.
Good answer, Konstantin.
try very hard.
There you go. There you go. So let's talk about parents and when they should first take their children to a dentist. And see, this is the thing I have an issue with. Not taking your kids to the dentist, of course, that is. But a lot of dentists don't think like this. And I just wish more dentists would think like this. But
I know.
go ahead. When do you think the parent should take the kid to the dentist?
Every time when people ask me when, it's one answer. And if you, as soon as you find out that you're pregnant, I'm talking about women, you have to come to the dentist. You have to bring your child to the dentist. And 2 weeks of pregnancy. Why? Because you can do a lot of things to prevent development of some dental issues, some malocclusion issues, and some issues with TMJ and sleep apnea in the future. And what we're doing at that moment, we're doing like a lot of consulting of the future mom, what they're supposed to do, and how to feed the baby, what they need to do to prevent not only right development of the teeth and jaws, but everything else. Everything else.
Yeah.
It all works together.
Yeah.
So and if they miss this moment, then we have to wait until the kid is 3 years old and for the treatment and for the do the cleaning, do the some prophylaxis. And usually I see kids, I'm starting to see kids around like 3.
Baby.
So
how cute. How cute.
and
So
in
cute.
my book, by the way, it's a
Love
lot
that
of
age.
chapters about kids, about what needs to be done and why.
Yeah. So informative.
So informative. I've learned some. I wish I could bring Serena to see you. I want to take her to see everyone.
I know you do. Every time you say I'm taking Serena there.
True.
But
I'm like Serena here, Serena there.
Yeah. So when choosing a dentist, what should the listeners ask the dentist, or what do you look for in a dentist so they know they're in good hands? Because like we said, they don't teach this in dental school. And how do you know this dentist is like, what is like the flag that says, oh, right, green light, this is a good person to go to as a dentist, or
Are
red
you
light,
asking about JFO or TMJ treatment? Or like
first of all, let's say this. First of all, your right dentist could be right for you, but not for your neighbor or relative. You know, this is number one, because it's a little bit more than just a knowledge, than just experience. I mean, you go to the dental office, you see like tons of diplomas, and but you need to have a like chemistry, let's say this, with a person who's going to
trust.
Treat you, right? You have to develop some trust. You're absolutely right. And it's very easy. You come into the office, you see the dentist, you ask him, are you good dentist or are you bad dentist?
Well, who's going to sit there and say, I'm bad? I'm a bad dentist.
Yeah, if he's going to say that I'm bad dentist, this is the right person. No, seriously. Seriously. But you can see, if the dentist only see the teeth, maybe it's not right person for you, because if you're going to read my book, you will understand that this dentist is very complicated thing right now. It's like can affect the whole body. And if the doctor kind of look only at the tears and he kind of think about how to make nice smile without putting the jaw in the right position, then again, maybe it's not the right person for you. And I see tons, and maybe you also see the tons of the patients with a nice, beautiful work, but it's beautiful but not right because it was done in a existing bite, and this bite is not
Right.
a right thing. Well, let me give you one like example.
Go ahead.
Let's say you have a little crowding on your lower front teeth.
Okay.
Almost like 90% of people have this, right?
No.
And it's very easy to go to the dentist, and dentist will give you aligners like Invisalign and correct this, right?
Right.
But the problem here, not about the unpleasant look of the lower teeth. The problem here, if your teeth is crowded, it means your jaw undeveloped. In not only lower jaw, but most likely upper jaw.
Yeah.
Right? And when it's happening, your lower jaw goes backward.
That.
And when it goes backward, the tongue
Without
goes
even
backward and the closed airway. So basically, little crowding, meaning that you could have wrong bite, number one. Number two, constricted airway. Number three, sleep apnea and TMJ issue. And maybe you don't have it, but good doctor need to investigate this and not just give you aligners to align your lower teeth, but investigate this and
respect the muscles.
and correct it. And this is about just a regular crowding, that almost a lot of people have this. And another example I can give you, because you're gonna ask me this anyway, I guess.
Go ahead. Go ahead. Another example.
Double chin.
Oh.
Double chin. I mean, let's say you're not overweight and you have a double or triple chin. What is it? This is your tongue. Why? Because tongue doesn't have enough room in the oral cavity. Why? Because most likely you have a wrong bite when your jaw went backward and upward and your oral cavity become smaller.
Yeah.
And when it's happened, tongue needs to go somewhere, right?
Right.
It can go forward because teeth there, and in the back it's all like fence. And upstairs we have a like palate.
Right.
It can go only down and backward. That's it. And when it goes down, you can see it. This is double chin. And again, if you what people doing with this, they go to the plastic surgeon, right?
Suck it out and go there.
And what the plastic surgeon will do without investigation, the plastic surgeon
Really
can give you like lift, right?
Right.
And before this lift, tongue can have a chance to go down, open airway. But after this lift, tongue have no chance to go down, right? Because it's like
so tight.
all tissue, and the tongue will go further back
into
and kill you, because people with a sleep apnea living like approximately 20% less. Like their life expectancy,
right?
It's like
they don't live as long.
15, 20 years less.
Wow.
And literally, this double chin, if it's not treating right, if the doctor doesn't recognize this issue, this double chin can kill you. It's not just a simple aesthetic issue.
I know. And
And
like so many women think it is.
yeah.
Yeah,
I
I
mean,
never really thought about when women get this. I never really thought about. I mean, even when you go like this here, you can feel the tightness and you can feel how things push back. And
yeah.
that is going into your throat. But I honestly never really thought about that because, I would like to have a little bit of something done too.
You
No.
in the beginning of our conversation, you mentioned about patients, right?
Yeah.
Who you saw today.
Yeah.
I saw one patient today, young girl with a piercing in your tongue.
Yeah.
Did you ever see patients like this?
I
Yeah.
have.
No, not
Uh-huh.
yet.
Listen, and she asked me, "Is it okay?" And I looked at her CAT scan and see it's like 5 millimeters airway. All right,
Right.
straight neck. It's already body try to compensate for this, right? It's straight neck instead of like curve, right?
Mm-hmm.
And now what she did, she kind of make the tongue even bigger to put this
Earring in
piercing.
it or tongue ring. Yeah.
And I ask her, why? Why you don't want to remove this? And I explain everything
Right.
why she needs to, and she told me, "Oh, my boyfriend like it."
How
All
old is
right,
she?
young girl. I don't
18?
remember.
20s.
No. It's like 20 something.
Yeah. Yeah. So you're going to make your life miserable just to be pleasing to your boyfriend. She needs to learn something.
I mean, I guess they didn't read my book yet.
Yeah,
So
they
that's
didn't. I'm
that's
thinking they didn't. Oh my
I
that's
God.
the
I
answer.
don't I
So
think it's very clear that they did not, and they should.
Yeah.
yeah. So you see, I can like talk all day and give you like tons of examples how we need to see our patients and what can be behind some simple stuff.
Mm-hmm.
But like I said in my book, and they need to understand. The patients needs to understand. People needs to understand what's going on.
Yeah.
And kind of request different type of dentistry.
Based off of that, right?
Yeah, you
Hmm.
know, like long time ago, we started to do laser whitening. Like one of the first people we started to do laser whitening in our office in Boston. And the Bright Smile company
Yeah. I remember.
decide to advertise to the public, not to the dentists. Like Zoom, for example, Zoom advertised to the dentists. The Zoom came to to dental offices and asked us to buy the equipment. But Bright Smile advertised everything to the public, and people start to ask us, "Do you do Bright Smile whitening?" And this is how everything happened. So the same thing with my book. If people gonna come to you and ask you, "Doc, what do you think about my double chin? What do you think about
That's good.
my bite, and et cetera," then maybe we can change
Yeah.
this trend. You
Yeah.
know,
I hope so.
yeah, that's. I think that's why we're doing this. What we're doing now, right? We're doing this podcast, right? This is for patients, right?
Right.
Yeah.
Patients and dentists and just whoever wants to give us a little bit of time, we're glad to talk to them.
Absolutely.
So what about when it comes to sleep apnea? How do you, because there are sleep doctors here in Pittsburgh, and there are sleep docters that recommend that Inspire, the thing that you embed or implant in the back of your throat, and there are other dentists that just say they're just sleep
Yeah.
doctors, so they just do sleep appliances. So
But they like dabble into TMJ enough that like it ruins their patients and then they come see us.
right, right, they'll move the jaw or whatever. But what question should a patient ask the dentist if they're going to a sleep dentist?
First of all, let me say, and you know this, sleep apnea and TMD issues, it's two sides on one thing. All right.
Right.
And in my office, it's rule. If patient has TMD symptoms, we assume that this patient had a sleep apnea
Mm-hmm.
until we prove opposite, right?
Mm-hmm.
Because statistically, between 80 and 90% of patients with TMD have sleep apnea. So, and since this is such a huge correlation, this is tactics what we use. And it's very easy to prove because right now it's like you can provide very simple screening test for sleep apnea, and this is one night sleep test, and you can answer this question. So basically, patients, if you have a like, if you snore, especially loud, if you have a daytime sleepiness, if you kind of grind your teeth, it could be because you have a airway issue, you have a sleep apnea issue.
Yeah.
So if you have some symptoms like this, you have to go to the dentist. Why to the dentist? Why not to the physician or pulmonologist or
Right.
ENT?
I think the
Because
dentist can tell you because your mouth is too small or no.
yeah, exactly. Because the cause, the real cause, like at least one of the biggest, is anatomical discrepancy.
Right.
It's anatomical deficiency of the oral cavity. That's what the reason number one. That's why dentists now play huge role in uh, screening. And again, you go to the dentist regularly, right? Twice a year or three
Right.
times a year. And listen, we have a time. You go to physician once a year. I mean, he has a 7.5 minutes, right? To see you and to ask you questions. And physician doesn't have a time. He needs to like
Yeah.
write down like everything, like work on his computer. And we can talk to the patient a lot, especially when we're doing the procedure, you know, and patient can interrupt you, right? you can,
I'm sure sometimes they wish they could.
yeah,
Right.
right. And some people, you know, you put a rubber them and they still talking about some issues. But the dental office is a great place to do the screening for
Yeah.
sleep apnea. So, and
Definitely.
this is proven thing. Um, and another thing, 90% of patients don't know that they have a sleep apnea. That's the real issue. 90%, it's a lot. It's a
That's a
lot.
lot.
Yeah, that's why we all. I'm not saying that pulmonologists and the ENT doctors don't want to treat, but they dealing with complications. They see patients when they have a severe apnea, and they don't even care about if it's like slight, if it's mild. And we do, because we can prevent this. We can treat it. All right. So that's why.
Yeah.
That basically, it's not the patient needs to ask the doctor. The doctor needs to recognize this issue and do everything possible. Do everything possible to treat sleep apnea, because it's serious health issue. And if the patients coming to me with some problems, right, with the headaches, with some sound in the ears, like pain, some problem with teeth, bite, but if he has a sleep apnea, this is a number one issue, and we're doing all treatment to try to resolve it. Sleep apnea, because you don't want to have a nice, beautiful smile and lay down in a
don't wake
basket.
up.
Yeah, it's not gonna help. Right.
Well, let's switch gears to another topic in your book, the anti-aging dentistry. And I know that when we're dealing with people and we have pain and all of that, and once you open the bite, relax, whatever, but you never hear about people thinking about dentists when it comes to anti-aging, other than a bright white smile. But they think of a skin spa, or they think of a plastic surgeon, just like you were talking about the double chin. But how can we be more of an anti-aging, or get the voice out that we too are anti-aging? So how does dentistry play a role in that?
First of all, let me tell you that neuromuscular dentistry, it's anti-age dentistry, right? Because we're doing this for years, and this is the beauty of a neuromuscular concept. And what is a anti-age dentistry? Actually, me and my friend developed this term, right?
Nice.
I know that everybody talking about this, but
what is it called?
Anti-age dentistry, meaning whatever. Yeah, sorry for my accent. The point is that it's not about look younger, right? I mean, it's not about only look younger. It's about look younger and feel younger. That's the big difference between aesthetic dentistry and anti-age dentistry. All right, that's the biggest issue. And I gave you example. You can give a patient like bunch of veneers in the existing bite, but if patient has a constricted airway, it's not anti-age dentistry. Yeah, it's beautiful smile. But if patient has a sleep apnea, he's not gonna live longer, right? He gonna like aging very, very fast.
Yeah.
And again, if you recognize this and you put the jaw in the right position, meaning right position from the point of view, point of muscles, joints, airway, and central nervous system. And if you put the jaw from all these points to the right position, then it will be and create veneers and create beautiful smile and improve face aesthetics of the face. Then it's anti-age dentistry. And that's the huge difference. And it started in Europe and we started this in Russia, and now we kind of move this here. And in Dubai, by the way, we just doing like huge project for longevity clinic. It's dental clinic, and it's not going to be only dentist day. It's going to be all other cosmetic procedures, plastic
Interesting.
procedures,
Yeah.
and sauna and the infrared and all other modalities. And this is like huge project. And why dentists? Because if you want to look younger, for example, you go to the plastic surgeon, and if you have a good cranial structure,
Yeah.
right? Then the result of plastic surgery going to be good, and the result
Yeah.
will last longer.
Right.
Like Kris Jenner, right?
And who is can create this nice cranial
Yeah.
structure? Dentists. So that's why before this, my recommendation to your listeners and viewers, that before you go to the plastic surgeon, go to the dentist, see what dentist can create, and from anti-age point of view, and then you can do all cosmetic procedures and
Yeah.
plastic
Yeah.
surgeon procedures.
Yeah.
Oh, sheesh. I learned a lot.
Well, what about, you're talking about that? What about veneers? Because, well, I see patients that sometimes get crowns or veneers, and when they talk, you can't even see them, and it
Yeah.
looks like a little black hole. Unless they smile really big, then you can see them. But what I really wanted to ask about veneers, what are the myths about veneers? Because it seems like a lot of younger kids and stuff now want veneers, and I think that's the social media thing, which is fine.
Well,
But
they see like these
what are the
people going to
myths?
Turkey and getting their teeth shaved down to nothing. That's a myth.
Yeah, it was some publicity about this, right? Uh, First of all, veneers is very conservative and good aesthetic restorations, and it can improve the smile. But it's not only about this. Veneers could be a part of a TMD treatment, could be a part of sleep apnea treatment, and other functional problems. It's not just
Yeah.
aesthetics. Every time when we dramatically change the position of the lower jaw, for example, if patient grinded uh, his or her teeth to almost nothing, right? We see these patients all the time, right? And you need to restore them. The best way, at least for the front teeth, is veneers or other ceramic type of restorations, right? But we need to find the right position of the jaw and use the veneers to do the restorations.
Right.
And this misconception or myth that veneers only for aesthetic reasons. This is not right. We're using the very rare. I'm using veneers only for aesthetic
Yeah.
reasons. Like patient come with like
Good point.
tetracycline
Yeah.
teeth, and the whitening doesn't work. So then we using like veneers. But most of the cases, 90% of the cases, is just treatment of TMD issue or occlusal issues.
In
Yeah.
our offices,
Yeah.
not in other offices that are non-neuromuscular.
No, in our office. In
Right,
our
right,
offices, you mean all these 5 offices? This is
right, right.
what we're doing. Yeah.
Yeah.
And another mistake people doing, they doing veneers, and they ask doctors to do very white artificial veneers. And some people like it. Some people kind of show your smile, and they want to kind of show everybody that they spend a lot of money to do this, but it's not the right approach. Every time when I see like very white veneers,
Yeah.
I know that this is not a doctor chose
It's not.
this
It's
color.
usually not.
It's most likely patient ask us to do this. So, but a long time ago we did a study. In our institute we did a study, and we took patients who we treated with veneers like at least 10 years ago, and only for the one jaw, and we compare this, like, let's say, upper veneers to the lower teeth, to their lower teeth,
Yeah.
and see what happened with our veneers and what happened with their teeth. And what we find out that 90+% of people have veneers look like it was done yesterday, and their own teeth in 60% of the patients had some issues like decay, fillings, some teeth were extracted, etc. And one of the conclusion of this study was that veneers saving teeth. Then this is a obvious kind of conclusion, because teeth with veneers was like it was done recently, right? So, and this is not just opinion. We did a very serious study with almost 40 people with and some veneers people had for like 20+ years. So
Where did you go to observe this?
where did I go to? Where?
To make the study. You said,
do the
was
study.
that your
In our institute. We're doing a lot of study in we the office in in Moscow, in St. Petersburg. It's called Boston Institute of Aesthetic Medicine. So that's the name. So, and we're doing a lot of research, and we continue to do a lot of research. Not only we treat patients, but we're doing some research.
Well, thank you so much for being on, Doc. We learned so much from you. Is there anything you wanted to add before we sign off?
The only thing that probably your viewers needs to understand that sometimes our patients have symptoms like a headaches, right?
Yeah.
And when you have a headaches, where are you going?
Where are you going? You're
What
going.
doctor are you gonna see? Like
Neurologist.
neurologist, or PCP, right? Or you just go to the pharmacy and get a Advil, right? Or some people, complain that they have headaches every time when they weather change, right?
I've heard that. Yeah.
That probably they need to see a meteorologist. So that's nobody goes
He
to dentist. Nobody.
delivered that with the straightest face.
Yeah.
I know he did.
I was like,
So, but you know that 60% of headaches, especially in this area, especially in temple area,
yeah.
it's coming from the hypertonicity of the muscles, chewing muscles. All right. So, and we can treat this. We can eliminate these headaches completely. So, and that's why I don't know how we need to let people know that we can treat not only teeth, but we can make people healthier. we can bring balance to their life.
To their jaws, their joints, their muscles, everything.
Starting with the
Right.
oral cavity, starting with the teeth.
Right.
Yeah.
Well, let me ask you this. So, okay, your book, How to Find the Right Doctor and Preserve Your Health, Youth, and a Beautiful Smile, it is on Amazon. And what did you say? You said Boston,
Institute of Aesthetic Medicine.
that is in Boston and in Moscow and over in
Yeah,
Russia.
we started to this educational kind of facility in Boston in 1994.
Mhm.
1994.
I don't think
And
Priya was born then.
uh, of course not. Of course not. I'm doubt that you were.
Oh, God, you are. I love you.
I know, he's so sweet. What year?
1994.
That's
I
This
great.
is
was
when we
So,
started
born.
with my
so
partner,
then
Dr.
how can
Schwarzer.
people find you? They can find you by looking up your book. They can find you in Boston. Do you have a social media? Do you have
Oh
Instagram?
yeah, I'm everywhere on the social media.
Okay, so how do
Great.
they find you on Instagram or TikTok or what's your
Yeah,
tagline?
yeah. Instagram, TikTok, whatever. Yeah, and actually, we're going to start to do other channel
YouTube?
to educate people in English.
Oh,
Because
okay.
it's a lot of done in Russian, but
Yeah.
now with the translation you can open and listen whatever, and we have a lot of good information. And you mentioned this QR codes. So these QR codes bring you to the some visual topics, and when I explain some additional stuff. So, but I recommend to read this book
Absolute.
not only to the patient but to the doctors, because what's gonna happen?
Absolutely.
Patient's gonna come to you and ask you some questions from this book,
And then you say,
and
I don't know. We can't say that.
right, and
Then they're
and
out the door.
I know.
and go back to your question how to
Yeah.
find
Yeah.
good doctor. This is a
Yeah.
good test.
So your son's practicing with you now, correct?
Right. Yeah.
So he's learning
Daniel.
everything with you.
Yeah. You met him, right? Yeah. And he actually study everything, and he went to the Prabhu course
Right.
already.
Yeah.
He went to some business, because I teaching him business aspect of dentistry, and we have a like big plan for the first 5 years. He needs to kind of get the all knowledge what I got
Yeah.
for
He
like
will.
He
40
will.
years.
He
40 years.
will. He
Yeah.
always seems like when I saw him in Chicago, he's
Yeah.
he's extremely interested and he wants to learn and you're
Whoever
blessed.
will, he'll learn.
Yeah.
Yeah.
Well, listen, thank you again.
You.
And I love you,
Oh,
right?
thank you very much. It's like me too,
Ah,
and
all
we,
right.
we have a long relationship, and I always respect what you're doing with other girls as well. So
Well, thank you.
you I mean, good kind of
Mm.
I don't know. Hey,
All
it's
right.
my
Well,
dog came, so that's
aw.
to tell me to bring her out. So, but yeah, and whatever you're doing for ICMA organization and for the dentistry, it's nice to have
Yeah.
you as well.
Thank
So,
you.
Thank
Thank
you.
you.
and
Appreciate it.
And
thank you very
we're glad
much to
to have
having
you.
me here, and
Okay.
anytime.
Okay. Okay. We'll have to have you back because you have too much
Yeah.
in that book.
All right.